Today, let's talk about safe and effective early use of beta blockers after pediatric heart transplantation. Beta blockers have been increasingly incorporated into the management of heart transplant recipients, with data supporting decreased mortality in adult recipients. However, very few studies have evaluated the use of beta blockers in pediatric recipients, and early use after pediatric heart transplantation is still associated with hesitancy among providers. We sought to evaluate the safety and effectiveness of early use of beta blockers after pediatric heart transplantation. Coming to the method, a single center retrospective review of pediatric patients who have undergone heart transplantation were carried. Patients were included if they received any oral beta blockers within the first 6 months after heart transplantation. Patients who received only intravenous beta blockers were excluded. Coming to the results, out of 75 heart transplantations performed, 22 patients were identified with 25 courses of beta blocker therapy. Median age of heart transplantation was 11.2 years. The most common indication for heart transplantation was cardiomyopathy in 17 out of 22 cases. Beta blockers were most frequently started for stable atrial tachyarrhythmias in 12 cases, either as monotherapy or in combination with other medications. Other indications included atrial hypertension or afterload reduction, ventricular arrhythmias, and diastolic heart failure. In two patients, more than one course of beta blockers was given. Beta blockers were started at the median time after heart transplantation of 21 days. Metoprolol was the most frequently used, and other agents included propranolol, carvedilol, atenolol, and sotalol. Median duration of therapy was 170 days. Adverse effects occurred in two patients. Treatment had to be stopped in one patient due to profound bradycardia, with full recovery after discontinuation. There was no other associated complications. Early discontinuation also occurred in 4 patients due to unsuccessful beta blocker therapy. At median follow-up of 4.5 years after heart transplantation, 7 patients continued to receive beta blocker therapy. There were 2 deaths during this follow-up period, both unrelated to beta blocker effects. To conclude, beta blocker use was not rare during the early period after pediatric heart transplantation, while mostly indicated for stable atrial arrhythmias and blood pressure control. Beta blockers were effective in 80% of cases with very few adverse events. Further research is required to determine any impact of early beta blocker use on survival after pediatric heart transplantation.